Hi, this is Joseph Pate, better known as Medicare Joe, and in today's video we're going to be talking about the Part D late enrollment penalty, how it can affect you when you're on Medicare, and how it can affect the future cost of prescription drug coverage for you if you go without a drug plan when you start Medicare. So stick around. Welcome back. Again, this is Medicare Joe, and in today's video, we're going to be talking about the Part D late enrollment penalty and the effect that can have on someone that does not have prescription drug coverage while they're on Medicare. We're also going to talk about how it can affect the cost for your prescription drug plan in the future if you forego having a drug plan from the start at 65. So periodically on this YouTube channel, we do upload new Medicare educational videos. And if you'd like to be notified when we post a new Medicare educational video, click the red subscribe button here in the bottom right-hand corner. That'll send you a notification anytime we post a new Medicare video to YouTube. So without further ado, let's dive into some of the information. Now, you're probably watching this video because you're wondering maybe if it's worth having a drug plan when you get onto Medicare. Or maybe even worse, you forewent drug coverage when you started Medicare and now you're being assessed a late enrollment penalty. So before we actually go over the late enrollment penalty and how it works, we first need to understand what it actually is. So the Part D late enrollment penalty is assigned to anybody who is qualified for Medicare and does not have credible prescription drug coverage. So creditable prescription drug coverage would include prescription coverage through Medicare either on a standalone Part D prescription drug plan or a Medicare Advantage plan that has prescription drug coverage, or maybe somebody kept their work plan through their employer that had prescription coverage. Maybe they were on a retiree benefit through their old employer that had prescription drug coverage, or TRICARE for life with drug coverage, CHAMP VA as well. So if you had any of the following that I just listed off here, you have sufficed the creditable prescription drug coverage requirement for Part D according to Medicare. If you're of Medicare age and qualify for Medicare and you don't have one of the following, so maybe you just have A and B, Medicare A and B, or Medicare A and B with a supplement, or Medicare Advantage only that does not have drug coverage included. Well, in the eyes of Medicare, if you have a period of 63 days in a row without having credible prescription drug coverage, they're going to assign you a lifetime penalty. So now that we understand what the late enrollment penalty is, let's talk about how it works and how it's calculated. So we know that if we have a period of time that's more than 63 days consecutively without prescription drug coverage, we're now going to be assigned a late enrollment penalty. Now, the way the penalty works is it's 1% of the national base premium for every month you went without prescription drug coverage. Now, the base premium now is $32 per month. That can fluctuate year over year, but let's just use that for today's example. And let's say that you had 3 years without drug coverage. So that's 36 months. The penalty is 1% times the national base premium of $32 a month. So our late enrollment penalty, if we went 3 years without prescription drug coverage, would be $11.52 a month. If we use another example, let's say we had a 5-year window where we did not have any drug coverage. So that's 60 months times 1% of the national base premium, which is $32 a month. So in this case, on a 5-year window with no drug coverage, we're looking at a penalty of $19.20 per month. Now, this penalty is a lifetime penalty, and it's charged on top of the retail premium for the prescription drug plan that you're looking to now enroll into, plus any income adjustments that you may have for that year. More on the Part D income adjustments in the video link in the description below. Goes into a little bit more detail on income-related monthly adjustments. Today, we're just going to focus on the actual late enrollment penalty for Part D. So let's say you didn't have an income adjustment and you wanted a drug plan that was retailed at $12 per month. Well, if you have a 3-year window without drug coverage, so you have 3 years of no credible drug coverage, that $12 per month plan is now actually going to cost you $23.52 per month, because the penalty needs to be added into the retail cost of that drug plan for you. If you went 5 years without drug coverage, the cost of that $12 per month plan for you without 5 years worth of coverage would actually be $31.20 per month. So that would be your total cost for that drug plan with your penalty plus the premium for the actual plan. Now, the kicker here with the Part D late enrollment penalty is how it's actually charged to you and when that happens. So the late enrollment penalty actually isn't charged to you where you have to pay it until you sign up for a prescription drug plan or a Medicare Advantage plan with drug coverage if you have gone a certain of time without having the drug coverage. So let's say that again. So if you have a late enrollment penalty because you don't have prescription drug coverage now, and you never end up having it in the future, they're never going to assign that penalty to you. They will only assign the penalty to you and make you pay that penalty if you had a period of time where you didn't have drug coverage and now you want to sign up for drug coverage. That is when you're going to be charged the late enrollment penalty. So some people that decide against prescription drug coverage, if they just never end up buying a plan 15, 20 years down the road, they're never going to actually pay that late enrollment penalty. They would only pay it if they then decided to start a drug plan after already not having creditable prescription drug coverage. So you only start paying when you have the late enrollment penalty and you start a prescription drug plan. So, and another note on that as well, when it comes to the late enrollment penalty, if you qualify for extra help. So if you have a low income subsidy, you qualify for extra help through Medicare, you will not actually have to pay a late enrollment penalty even if you have been assigned one. That extra help qualification completely eliminates you having to then pay a late enrollment penalty. Now, from time to time, we hear stories from our clients that they're being assessed a late enrollment penalty for Part D, but they did in fact actually have creditable prescription drug coverage, either through an employer and now they're retiring, etc. So for those folks that are being charged a late enrollment penalty, but they actually did have creditable coverage, it's just a mistake on Medicare's point of view of they don't realize that you had one, there is an appeal process to get that corrected to where now Medicare shows that you actually did have creditable coverage, so you're not assessed a late enrollment penalty. The link for that is going to be also in the description in the event that you need to appeal an incorrect late enrollment penalty that's being assessed to you. So I know there's a lot of numbers here in this video, a lot of terminology thrown around in the video, and that's okay. The purpose of this video today is supposed to be educational for you. So if something still isn't making sense, I urge you to rewatch this a couple of times if you need to. If you do have any additional questions or have a specific situation that you need clarification on, I just put the number here for you to contact our company. If you have any questions, our team here would be happy to help answer those questions for you. And if it's a specific situation, try to help you get through that appeal process if it's needed. So that completes our Part D late enrollment penalty video. Again, if you've enjoyed this video, please hit the like button. The way that YouTube works is the more likes a video has, the more popular it becomes, and the more people it will put it in front of. And that way we can educate more folks that are looking for videos about the Part D late enrollment penalty. Like I said at the beginning of the video, if you'd like to be notified when we post any new YouTube Medicare videos, click the red subscribe button here. That's going to notify you whenever we post anything so you can stay up to date on the content that we're putting out. And lastly, if you'd like to leave a comment or have any questions in the comment section below, I go through those personally. So anything about the video, questions you have, drop those in the comment section below. I'd be happy to answer. Again, this is Medicare Joe, and I want to thank you for watching our Part D late enrollment video. If you have any questions, we'd be happy to help. Take care.